Hey you guys, so I'm at another event. Today I'm supporting the WOW Project, which is a health and wellness community-based or grassroots organization that focuses on health and wellness through gardening. They are having their Black Maternal and Women's Health Expo today. Thank you for joining us for this very special episode, and it is jam-packed with information just for you. We are talking doula services, how to obtain and become a doula that's certified with a health plan, maternity deserts, how do we correct that issue? We talk about community-based and self-advocacy. We talk about mental health support. We talk about Black maternal health. We talk about everything you possibly will need to know at a Black Maternal Health Expo. We are so happy to have been a part of this fantastic event with the WOW Flower Project. Thank you guys for having us. Thank you for joining us, and don't forget to click subscribe. Give us a thumbs up so we can get this information further.
Hi everyone. So welcome. We're so excited to have you. I told someone I wish I was having a baby so I could have you as my doctor. Thank you again for being on the couch.
Thank you for having me. It's always a great time.
So tell us a little bit about you being a doctor, what took you on this journey, and where do you practice at?
So hi everyone, my name is Dr. Taska Moore. So I saw the need for people who looked like me, and I wanted someone who looked like me to take care of my family, and that became my motivation into the field of medicine. Women's health sort of just kind of naturally fit. So I have a mom who's very passionate about caring for others, caring for women, and so I grew up serving, and being someone who wants to serve is kind of really what should be the foundation of medicine. And I realized the maternal mortality issue for a very long time before it became publicly aware. So I am a missionary doctor as well. And so I travel around the world. And for me, when I prepare to go to different countries, one of the things that I do is learn the culture, learn the people. And when I started to look at the stats, I started to see countries that were underdeveloped, considered or categorized underdeveloped or developing, compared to the US data. And it was very alarming to me that our maternal health outcomes weren't that better from countries that were considered to be underserved countries. And so this has been something that was aware to me from the very start of becoming a physician and working in other countries. That's how I became aware of the information.
What would be the first thing you would say when a person prepares to get pregnant? What should they do to prepare to say, I want to have a baby?
So that's a great question. And I'm glad that we're starting there, because a lot of the research is really showing that the outcomes that we're seeing generationally, transgenerationally, start from the preparation. So I do like the perspective of looking at pregnancy before being pregnant, looking at pregnancy health starting before conception, essentially. And that's because a lot of our genetics, we look at epigenetics now, is becoming sort of the trending topic, and looking at the fact that some of our outcomes and our genes are already a part of who we are by the time we are mothers. And a lot of the things that women experience in their pregnancy, whether it's mental health related, having crises in their lifetime, having not access to healthy foods, really impact outcomes even before that they are pregnant. So it really is a key opportunity for us to be able to have not just impact on the current woman and her outcome, but also her grandchildren and her great-grandchildren. And so you are literally, every pregnant woman who's here today is carrying her grandchild, right? It's more than just her child. And so looking at those outcomes, and then also looking at the men. We focus so much on the women, but the research is showing that the outcomes are also impacted by the husband's or the father's or the sperm donor's health and his history. So if he's struggling with weight, then his grandchildren also may have those struggles as well. So the information is really starting to gear towards us really supporting women from the start and being intentional about having children. Not just letting it be it wasn't planned, it just kind of happened, and so here we are. And there are circumstances of life where that can happen, but if we can decrease those episodes, those outcomes, and increase the mom's empowerment in saying, this is what I want. I want to have a child at this particular age. I've thought about it. I have the information. I know if I focus on my career and I'm an older mom, I may encounter some other challenges, but I have that information. I know what to do, right? Or perhaps I want to delay my career and I want to have my children earlier. Just really giving the women the information and the truth about everything so that you can make those decisions and be very intentional. The science has always been there. The more intentional we are about our health, the better the outcomes. And so making sure that there's no food deserts, fighting against that in our community, making sure that not only do you want to be healthy, but you actually have the access and resources to be healthy. It's one thing to tell a woman of color, it's important for you to be healthy, eat well, and exercise. But then we live in communities where there are so many barriers for us to be able to even do that. And that's why it's important to have advocates like Waunette to be able to work on the policy side, work on the community service side, so that we can bring healthier food options, so that our neighborhoods are safer, so that there's less policing. We're not feeling nervous about going for a jog or going for a walk. All those things are really important in our outcomes. So to answer your question, it's multifactorial, and it really requires us to, I would say the foundation of it all is intentionality.
Valley is a large expansion of mileage. We go all the way to the San Bernardino line. So if you're way that way, you got to only come all the way to Lancaster to have a baby. So it's a far distance. Like someone, I think you were speaking about, if you lose a baby and you're traveling an hour just to get to the hospital. You touched about like Blue Cross not having those maternal services here. What services do you all provide here in the Animal Valley?
So one of the things that began before I started, and I know that we're really working to make sure that it continues, because I think maybe it may not be as aggressive as it was. So if you go to the community clinic here that one of our doctors does work in for just general medicine, there is an opportunity to complete like a application for First 5 LA, Welcome Baby. Are you guys familiar with First 5 LA and the Welcome Baby? So what we were doing initially prior to me coming on is trying to get birthing people enrolled through the clinic into Welcome Baby. Because one of the things with Welcome Baby is that a lot of the enrollment, if it doesn't happen during your pregnancy, happens after birth. So they'll have someone come to you in the hospital and kind of talk to you about the program. But as to your point, that is helpful, because having that home visiting program postpartum is great, but we want to prevent adverse birth outcomes, right? Mm-hmm. And as the doctor presented this morning, we have in California, 4 to 6 times worse maternal outcomes, deaths, which we don't like talking about the data, in California. You think, what? And California has a very small population of African Americans, so that's a lot of African Americans, right, that are dying, right? And as you all know, there was a death at Cedars, there was one at, Centinela? There was one at, I'm trying to think of the most recent, there was another one downtown. California Hospital, was it? And so I think, just from my assessment, that, hospitals don't want the liability, right? You can speak to that. They don't, right? And they're not potentially equipping their hospitals with what is necessary to prevent these things.
Unless we just plugged today, guys. So I'm excited. I've been, everybody knows I've been working my butt off trying to get him out. But I definitely have been enjoying this pregnancy, because I've had one heck of a village with me throughout this whole process. With my first son, I didn't have such a big amount of support that I do now. And like, for instance, like almost all of us, we didn't know nothing about no doulas. And I now have a doula with this baby, Miss
We do, sorry.
And she's amazing, and she also helps, and I appreciate everyone's love and support. I unfortunately have to have this one at the hospital. I love the birthing center. I wanted to have my baby in water this time again, but it's not all bad, because now I have a doula, I have support, I have people to speak for me, and I know how to speak for myself this time around in the hospitals, because the first time they wouldn't really let me do anything. Like, they're like, oh, you can't do this, you can't do that, you can't do this. But now I have all these beautiful women like, nope, you tell them what you want, this is your baby, your pregnancy, we're gonna get through it together. So I really appreciate you all, and yeah.
As a doula, working with moms,
Mm-hmm.
and I know there was some kickback with some of the medical staff, having doulas, come into their space. How can we bridge that gap between the doctors, the medical staff, and the advocates that's coming in with these beautiful women?
Oh, that's a great question, and I'm glad you brought that up, because I've watched sort of the efforts that are being made, and it's so separate. We're so divided, and it's really a shame, because there's value in every aspect of healthcare, right? And so the doulas are over there doing their thing, the midwives are over here doing their things, and the doctors are on the other side doing their things, and it's really to the detriment of the movement itself. I think definitely egos have to be put aside. I think there's lots of egos in the space, but also just being more informed and really understanding roles and really understanding the purpose of what we're doing. And the purpose of what we're doing is so that women like them have enjoyable outcomes, not just safe outcomes, but actually enjoy a pregnancy experience. It's one thing to have a safe outcome, but you feel traumatized by the whole process of it, right? And so it's really important for us to basically come together, and leaders of these spaces who understand the importance of us working together, actually being at the forefront of having these conversations. It's such a fight to get a doula. It is so hard. I mean, I'm always messaging, yes, it is so hard. And so I have a large percentage of Latinas as well, and you can forget it. The good thing is that, unfortunately, because we have such a need for Black women to have safer options, there are programs that are geared towards really increasing the availability of doulas in that space. But for other communities of color, it's really it's still a lot. And sometimes we forget about our Pacific Islanders, and we forget about the Alaskan Natives, who also have bad outcomes just as much as Black women. And so it's really about having the availability of doulas for all women, and availability of midwife options for all women who are appropriate for that level of care, and then working collectively. I mean, I love y'all.
Okay, well, I know Waunette, she was saying earlier, doula, thank you, doula sister. The explanation between midwives and doulas, like she said earlier, a lot of it's like, okay, doula, what is that? They really haven't heard of it. Oh, that's who delivers babies. Can you elaborate on that, please?
Yes, so midwives are health professionals, right? Midwives can provide your prenatal care, can deliver your baby, and can support you postpartum. Doulas are not medical professionals. They are birth workers that support you through the journey. And oftentimes, a lot of doulas partner with midwives, especially in birthing centers, to support your pregnancy 360 degrees, all the way around, right? And so there are various types of licensing. So there's licensed midwives, there's the nurse midwives, midwives. They have a lot more extensive trainings because they are medical providers. And I just wanted to have this conversation, and maybe we can have this. I know that the doulas are reimbursed. They are paid as Medi-Cal providers. the same reimbursement rate as your OB provider. And so a lot of the pushback between the OBs and what's going on in the doula space is that they are not feeling that doulas should be getting the reimbursement rate that they're getting because they're not medical providers. But from my perspective and from the state's perspective, that as you said, the doctors go in there 15 minutes. The doula is with you for a very long time. Getting up out their beds. So from my perspective, if you look at it from an hourly perspective, that's still not enough money for the doula compared to the time that that OB is spending with you. And that's a lot of the pushback that I'm hearing because I attend the state meetings. And the other challenge is that is a lot of the hospitals are not allowing the doulas in with their they call them clients, with their clients. So, we've had doulas, fighting at the front door to try to get into a delivery, and then we have a member calling the plan mad because the doula didn't make the birth, not understanding what's going on, and come to find out the hospital wouldn't let her in, or saying, she can't go into the delivery room. I had a doula that the member had a C-section, and the member wanted her there with her spouse, but they wouldn't let her. So she basically had to hang around and then go see her postpartum. So you need to advocate for your doulas to be in your delivery if you want.
So my birthing plan is to go natural, no epidural. I am going to the women's pavilion as well. I'm 26 weeks and 3 days today, so yeah.
We know that the healthcare system is broken, and we know that there has been harm done to us as African American birthing women, people, but we also know that we're trying to fix it. And California, in some respects, is a leader and a trendsetter, and other states look to us as we look to those that went before us in this space. But do know that we are trying as a managed care plan to support you through that process. And to be quite honest, I am the doula benefit at Blue Shield California Promise. I cover doulas in all of LA County and San Diego. Promise plan is only in Los Angeles County and only in San Diego County. So you have to be a contracted plan, and so we're contracted in those areas. So if you were to contact us, it would probably be my staff, because we have a doula email box, but it would be us. We're there, we're available, but we really aren't member facing. We're doula facing, we're provider facing. So if you know of a doula, for instance, this is your doula and she is, the state requires that doulas be Medi-Cal providers, which is a wonderful thing. They have to support, apply with several documents to just prove that, they've had their, you probably would HIPAA training and their CPR training, some various things of that nature. And then they go through the state portal. It's called the PAVE system. And once they're approved, they are Medi-Cal providers, just like your OBGYN or your Medi-Cal dentist or whomever. And then at that point, they go on a list. And the state, the DHES, you can go DHES, has a list of all the doulas that are Medi-Cal providers in the entire state of California. And you can select your doula from there, or you can contact your plan. We like our members to contact us because we have a maternity care program that's really catered to helping and supporting birthing people. We do outreach calls, the nurses do outreach calls and the care managers, but it's an opt-in, opt-out. So if they introduce the benefit and you say you don't want it, then that's it, it's done. But if you opt in, they provide you with support services. You can get a breast pump, you can get lactation support, you can be connected to a social worker, whatever the plan has to offer. And there's also something else that's going on in California is Medi-Cal is being, for lack of a better word, revamped, and they call it Cal-AIM. So if you hear this term Cal-AIM, you're like, what is that? Medi-Cal revamped. And so because Medi-Cal has been revamped through the Cal AIM, you know, the state is requiring a lot of things of managed care plans, and we really have to be accountable, and our services have to be member-focused and centric.
I'm 40 weeks, so my birthing plan is to go natural. I'm giving birth at Antelope Valley Hospital in the WIP Pavilion. I'm trying no epidural, but I will take whatever other drugs.
And it's there. You might have heard this word, health equity. That's a big buzzword now. And so for me, what I am charged to do, in addition to standing up and operationalizing the doula benefit, like running it from end to end, making sure that it runs, is that I have to look at all the services that Promise provides for birthing people, the maternal and infant health population, and I have to look at it from a health equity lens. And when you say equity, health equity and equality are two different things. So equality means what? We all get the same thing. All of us had waffles. Everything's equal. We could get anything we wanted to eat on that table, right? Any drink. But when we look at equity, this beautiful birthing person right here couldn't get up to go get her waffles, let's just say. So equity would mean that someone would bring her waffles and her fruit, as opposed to making her having to get up. So now it's trying to ensure that health equity, and particularly in the state of California for African American, Black people, Native Americans, and they call it the BIPOC population as well, Native Americans and Asian Pacific Islanders. The data shows, as we've already heard today, that it's unfavorable for us. So we are really trying as a state and a managed care plan to ensure that those services and the available health care for us is equitable.
I'm not from the Antelope Valley. I was originally born in Las Vegas, and then I was raised in Cullors, Georgia, and then I moved to Savannah, Georgia for college to get my bachelor's in fine arts. And when I found out I was pregnant, I wanted to be closer to my mom here, so I moved here in October of last year. And this is my first time being in the Antelope Valley, but still I feel very welcomed and at home. I was able to find a lot of different resources and groups to be a part of. I have two amazing doulas part of the Divine Birthing Services. So this is my first baby. I'm having a girl. I'm really excited. I was due on Monday, but we're still waiting. So I'm excited, and I'm thankful to be here and to have so much resources and to be able to have people advocate for me. And I'm excited to give birth any day now.
How do we, as a patient, how do we select our gynecologist or obstetrician or hospital, or even how do you start advocating for yourself if you've never done that? Because I sometimes talk to people and they're like, well, they just gave me that doctor, and it's that person is looking between my legs, you know what I mean? They're about to deliver my baby. I'm about to want to have a relationship with them. How do I advocate to find who fits me? You know?
Yeah, that's a great question, and it's such a privileged relationship to have a relationship with women in this particular context, especially, right? So you're right. The whole exam is a very intimate encounter, and it's important that you feel comfortable with the person who's seeing you and caring for you. So it starts with word of mouth. One thing about our community, we gonna talk about a bad experience, and we're gonna let you know. So it's really important that we have those conversations again. So much about our society is making us isolate and not communicate as much as we used to. And it's really important that at those Thanksgiving dinners and at those holidays, that we start having health conversations intentionally. Knowing what our family history is. And then knowing who do you see, do you like your practitioner, do you not, and really sharing that information with each other and calling out those who are not doing a good job. Also, the great thing about the movement is that there are now different apps where you can go to different apps. Black Doctor is one, there's a number of them. They're not all in my head right now, but I'll get you some of them. Where you literally can go on the app and see reviews and see what people are saying about the clinician. And then the other thing is about social media now. Social media, you can actually find clinicians on social media. You know, people who you seem to like their vibe, still look them up though, because people can portray different things on the social. But doing some investigative work, and if your insurance tells you this is who you're assigned to, because that's the other arm of medicine, the insurance company makes so many decisions, but you can push back. Right? You can say, I know that's where you send me, I know that's who you're contracted with, but I want somebody else. And I'm paying you, which means I hired you, which we have to change our perspective of how we look at things.
Thank you guys all. Like, I just want to say, like, Waunette, thank you. The community, like, y'all show up and show up all the time. I had the honor and the privilege to be one of the first contestants of the Black Maternal Health Expo, and just the feeling and just to be celebrated and honored, I didn't know that existed. And to be from the Antelope Valley and to see and grow up here and not have that community, we had somewhat of that community in Sun Village, but to get out into Lancaster and Palmdale and see that we have a community for us, by us, it has been a phenomenal experience. And I'm so grateful for everybody that showed up and showed out in this moment, the education, the commitment, the community building that happened and took place, and just to be able to love on our mamas and honor our mamas. And thank you, because you guys bring forth life. And to be able to be in your presence today and to serve and to witness this experience has been phenomenal.
So the state has given each plan till 2025, they call them bold goals. You can Google that, to come up with, and I'm charged with prenatal and postpartum care gap closures. So wherever there are care gap closures, I'm now, as of last week, been told that I'm responsible for all of them. So if you do have an opportunity to connect with your plan, you know, reach out to them and tell them you want to have your voice heard, because there are community advisory groups. But what I hear, it's hard to get people to participate in those. So if you know about them and you know your voice can be heard, you let them know, hey, I want to be a part of this. I want to speak up for my community. And we know that Promise does have they partner with a clinic here, but there's no maternity care here, even from our plan perspective. So that's a big gap. So one of the things that I've said is that I would like to make this Antelope Valley a part of my work, like my work, my thought, because we really need to change what has happened here. And being in this land of angels, cities of angels, LA County, LA, and all of the wonderful things and all the rich Malibu and whoever other houses, and we have a maternity gap, a maternity care gap, not only here, but many places between here and Oregon, and down between here and Tijuana. It's just Imperial down that way. It's really startling, right? What goes on, you know, for us to have the reputation that we do outside of California, what we show the world. So there's a lot of work to do. I personally am a part of the solution because I want to be. So I'm here.
Well, thank you.
Thank you.
waiting to hear, is there someone good up there yet? Because it's such a trek. Imagine being 39 weeks and you're driving in a car over an hour to go see a clinician. I mean, we're talking about maternity deserts, which is a huge issue. And Roe versus Wade has made that issue worse.
Yes.
Regardless of what you believe in terms of the rights of women, just please understand that because of that decision, it had, I know I'm going way off.
We need this.
This is good conversation.
That's very,
Yes.
very
So
important.
what a lot of people aren't talking about, yes, we all have our faith and our belief system, and that should be valued, and that guides your decision for yourself. What has happened as a result of that, we were already facing maternity deserts, which means there are significant areas that, especially in the rural population, where there are no women's health providers. And so people have to travel far. Can you imagine miscarrying a baby and having to travel for a good hour to get help? Like that's almost, it's mind blowing. So that was already an issue. We already knew we were facing a shortage of OBGYNs. That was known for years. And that's why we're trying to increase the availability of other providers like nurse practitioners, midwives. But since that decision, we have clinicians who have left communities that they wanted to be a part of just simply because they're fearful. They're scared of the repercussions of making certain decisions. There's so many gray areas. No one wants to be in that gray area. You didn't go into medicine to end up in jail. You didn't go into medicine thinking that you would face these fines, the loss of your license, and the potential just simply because you want to care for someone who's in need. You know, it's just mind-blowing that that's what's happening. And so as a result of that, you have now patients who have even greater deserts. And maternity deserts equal GYN deserts, each equal cervical issues, equal pap smear issues, equal cancer diagnosis. So all these things are very much related. And it's important for us when things happen to really think about the big picture. Wait a minute, how many things about our health are being affected by this one decision? And having the conversations about that so that we know when we are making decisions at the polls, when we're making conversations privately, that we know the multitude of what that one decision means.
What kinds of services do doulas provide?
So for our plan and for all the plans in the state of California, so whether you're with Blue Shield, Kaiser, Molina, LA Care, whoever they may be, I don't know all of the plans that quickly at the top of my head, but do know that you are entitled under your Medi-Cal benefit for prenatal service, like I said, labor and delivery, and postpartum doula support. So in the prenatal period, you are allowed and should have a 90-minute initial visit. The doula can't run in there and say, oh, I'm here for 15 minutes, it's 90 minutes. I actually cannot pay that doula for that initial visit unless they have been there for 90 minutes. So you're allowed one initial visit for 90 minutes. After that, you and your doula can discuss how long or how you want them to visit you and support you, because they can do a telehealth visit. If you're a person that doesn't want anybody in your space and you'd rather a telehealth visit, they can do that. If you want phone check-ins, they can do that. And if you want in person, you can say, hey, I don't want telehealth, I don't want phone, I need you there with me. You can ask them for that service as well. You will get 8 additional visits, and they're interchangeable. You can either have all 8 in the prenatal period and none postpartum, because you know you don't want to have a postpartum doula, or you could have 4, you could have 2, you could have 3, however you want to mix and match it. And the other thing is that you can have more than one doula. So if you have a doula and that doula is like, hey, I can only do 2 prenatal visits, you be like, wait a minute, I need more. So you could contact your plan or reach out to a doula that is a Medi-Cal approved doula contracted with the plan. So I'll get to that as well.
Okay.
And say, hey, I need another doula, because this doula is only going to see me twice, but I need these other 5 visits. So you are entitled to more than one doula if you so choose. So you have the one 90-minute visit. You have the 8 additional visits, either prenatal or postpartum. Then you have 2 extended postpartum visits that can last up to 3 hours, right? And so that is a great opportunity for you to kind of look at all of your visits and kind of figure out, what do I need, how do I need to be supported, and how can this doula support me? In addition to that, you have, of course, labor and delivery. These services are available, as I stated, if you had a miscarriage, if someone has decided to have an abortion, or if they've had a stillbirth, you're entitled to the same visits. In addition to that, if there is a need for you, go back to your provider and get a recommendation, I'll talk about that, for 9 additional doula visits in the postpartum period. So Medi-Cal now in the state of California and several other states has expanded care for 12 months past your delivery. So I just want to be clear that you know this and share this information. So you can have your baby today, and for 12 months, you can have doula services. You're only going to get 9 visits, but if you want 1 visit a month for 9 months, or if you don't want any visits in the first 2 months and then you want to get some visits, you have a 12-month postpartum period to have those doula visits.
My birthing plan was wanting to have him natural, but I couldn't because I already had a first C-section with my daughter. So it was another C-section at this point. But I had him at the WIC center. That's the perfect place to me. I never had no problems there. The emergency room I had problems, but WIC, I never had any issues.
And so one of the things that California did, which was wonderful, is that doula services are required federally to have a recommendation. But what the state did is say, hey, we're gonna do a standing recommendation statewide. So for your initial visits, you only need to know the doula, have coverage by the plan that the doula is contracted with, and you can begin your services. You don't need to talk to your doctor, you don't have to tell anybody. The state has already said, the state medical director has already said, initial visits, we're covering those. But if you want those 9 additional visits, you have to get a second recommendation, and it can be from your medical OBGYN provider. And what the state did, they said it can be a provider of the healing arts. So you say, what is the healing arts? I had to look that up. So it can be a midwife, a licensed midwife. It could be a clinical social worker, a psychiatrist, an acupuncturist. There's a list of referring providers of the healing arts. So just maybe Google that on this, to determine, and if your medical provider, your OBGYN doesn't feel that you need those 9 additional visits, you say, no, I'm gonna go talk to a social worker. We talked about PMADs and postpartum depression and baby blues and all of those things. And so you might be seeing someone and they may say, hey, you need some more support in your home. So I'm gonna write a recommendation. You don't need a referral and you don't need a prior authorization. So if anybody uses that word referral and prior authorization, they don't know what they're talking about. You need a recommendation. That's all it takes. And then you can get those services.
And then I just want to touch on the mental health part also, because I don't want to, when we say know your family history, also know your mental health history in your family. So that we can identify those who are at risk, because Black women have less access to mental health services, are more likely to not get the help they need when it comes to perinatal mental health conditions or mood disorders. And mood disorders can also exist in the guy, also keep that in mind. So you're literally in this together.
Right. I have one more question. So you know how you talked about mood disorders after pregnancy, or they can also happen during pregnancy, right? So what are some things that we can do as a family for someone that is giving birth? And what are some signs that we can notice to help them?
I love that question.
Some things that we can see and say, okay, well, I think that they're having this issue. You know, as a family, how do we pull together to help our own family members when we see things?
I love that. I love that question. And I love the young lady that said she has a good village. I forgot who it was, but I was like doing somersaults in my stomach when I heard that, because the village is so key. And we know statistically that women who have less support are more likely to have mood disorders, right? Especially if you see that she has a fussy baby. And babies are fussy for a number of reasons, right? So parents who have fussy babies are also more likely to have mental health disorders, right? It's extremely stressful. And then also knowing if she has it in her family. So one thing is supporting and empowering the woman in how she wants to be supported, right? Because there are ways that I want to support someone that she may not be ready to receive that type of support and may be triggered and overwhelmed by it. So allowing her to make the decision as to what's best for her. Because every woman makes different decisions. So checking in on her, let her decide how to check in on her. So it's really important to keep the power in her hands. Some patients will say, oh, I want you to come over every now and then. And other patients may say, I'm not ready to have you come over, but a phone call I'll do, right? So asking her what will help you through this journey, and checking on her. Like if you don't see her showing up, she's not answering the phone, really do due diligence, because when it becomes severe, they isolate and they release their contact from everyone. So if you see someone disappear, definitely check on them, because they're more likely to have mood disorders issues. And then also providing things like we're so nurturing. We want to be there to nurture someone, but sometimes you can nurture from a distance, right? So making sure they have food, especially if she has other kids, helping her to release some of the responsibilities so that she doesn't feel as overwhelmed.
So I can take some food over.
Or you can go pick her kids
Or you can deliver the food if she's not ready, right? So you can take the food over, drop it at the doorstep if she wants that, or you can have someone deliver food, Uber Eats or whomever, deliver the food for her. Or you may say, can I hire someone to clean the house for you?
That's a good one.
Right?
And we're going to bring her back, of course, for some other talks in our new space to talk about Black health and just being healthier. She's going to be here for a while if you want to talk to her.
Absolutely.
We got to our pregnant moms are hungry, so we're going to start our lunch. And I just want to thank you so much for making that 14, first of all, coming up and everybody can feel like this is a space to be able to ask questions, allowing us to have this time to talk about birth, talk about women. There's more questions I'd like to ask, but I want to thank you for being here.
My pleasure. Thank you for having me.
We're going to start with the pregnant moms, and then we'll alternate, and everybody can help themselves to lunch. But again, thank you so much for coming here.
Heavenly Father, we got some hungry people in this house. We're going to pray real quick. Thank you, Lord, so much for Miss Waunette and her vision over the wildflower and this Black Maternal Expo. Thank you for the gift that she has for blessing everybody. I pray that everybody is fulfilled and that this food will be blessed today. In Jesus' name, amen. Amen.
Okay, you guys, so today was absolutely amazing. It was just such a warm and inviting space where we can be transparent and share about healthcare from all aspects, from the health plan's perspective, doulas, physician. It was just really, really good to hear the questions, to get the feedback, and to have real conversations. So, and most importantly, to see moms celebrated. What I especially loved about today was the fact that we got to see Black moms showing that there are changes in healthcare, that they're making more empowered decisions, feel more informed, have doula support, and they feel like they can advocate better for themselves. And then this space that was beautifully created by the WOW Project celebrated the strength and the beauty of Black motherhood. That is so important, and it's so great to see these images.
Hey, you guys, thank you for joining us. And believe me, this is barely
a drop in the bucket of all the information that was shared at this event. That's why you got to show up and make sure you are present so you can get everything you need. But we hope we were able to give you a good sample of what the event was like. Thank you guys for joining us. This is Dr. T, the hand behind the handle of Healthy Bump Club right here on YouTube and healthybump.club on Instagram. We thank you for joining us, and we hope to see you guys when the next episode.